I thought before I start on my talk, I would really like all of us who are academics in our own universities to think about perhaps running a survey of our graduates. So people who have gotten public health degrees from our own universities, reach out to some of your graduates, your alumni, and find out how they have been contributing to the COVID-19 fight in your own respective countries. Or if they're international students, find out how they have been contributing to the own COVID fight in those countries. Because I think as a public health academic community, it is very important for us to know how our students, how our staff has contributed to the COVID response in around the world. And we could start off by really finding out from our own alumni first. So this is just a task for everyone, including myself, such that after the whole episode, APAC can perhaps have a special session that really comes together and talk about how our universities, our own students, perhaps after graduating, they became directors of generals in the health ministry or so on, and they have led specific efforts in their countries to fight COVID. I think this is something very useful for us to track very carefully. Now, coming to my talk, I was given the task of really speaking about public health education and asking this question: do we really need a new normal, or has the need for a new normal in public health education always been there? And I think that that is a question that I hope to address over the next 15 to 18 minutes. I think we could start off by first asking what is really the value of taking up a public health education. And these are just my own thoughts of what public health education provides. Firstly, it is one of the few disciplines that thrives on a broad-based approach, a multidisciplinary, an interdisciplinary, and more importantly, a cross-disciplinary approach. If we look at COVID-19, you will clearly see that all the aspects that I've highlighted here, be it epidemiology, statistics, communication, health promotion, health economics, priority setting, social sciences, the ethics, the use of technology, the use of engineering, all of that will come in. And it comes together in a public health crisis. So I think this is one aspect that public health education provides. And the second is clearly about networking. And I see that in the global response, even in the national responses around COVID-19, we learn a lot from each other. The networking part is immensely more important than disciplines such as chemistry, physics, mathematics. So, and the shared experience actually changed the way we think, we research, and we teach our own public health around managing a crisis, be it a chronic disease crisis or an infectious disease crisis. And I think the other aspect is really we learn about setting policies and programs. And that is again different. In many university level education, they don't think too much about policies and programs, but we have a social responsibility that whatever we teach fundamentally has to be translated to something that will impact the community, that will impact individuals, and that has to be around policies and programs. There is the issue around how do we advocate good policy, sound policy making? What are some of the principles that we highlight around monitoring and evaluation, around making sure some of our policies and programs are sustainable, they are fair to everyone in the community, be it local citizens or foreign migrant workers contributing. And I think that, again, this is one discipline where looking back at the historical perspective, we actually learn about how to deal with current problems. So there are current issues, there are current strategies, but again, learning from the past actually works a lot. So one of the aspects that it's perhaps very relevant is really around infectious disease epidemiology that we have tracked since the very beginning of outbreaks such as the cholera outbreak in London, where the way that we conduct our modern epidemiology, our modern contact tracing right now, be it around SARS, Ebola, MERS, and right now COVID-19, it's grounded in this same fundamentals of contact tracing. We see the same when it came to SARS, where there is this global pattern of spread. So regardless of whether it is a localized outbreak, whether it was a localized problem, or whether it was a global problem, a lot of the context that we learn about applies globally as well. So this is why I come back to some of the things I talk about, the networking, the ability to draw such a map for SARS and right now for COVID-19 comes about only because we were able to get the community to come together, share data, share experiences for us to track down patterns very quickly. Contemporary inputs. In terms of technology, I think we have clearly seen how the use of digital technology has played an important role in managing contact tracing and very rapid communications, both in Taiwan and in South Korea. That these are places that have relied successfully on the use of technology to control the outbreak and to very quickly shut down chains of transmission. But I think when it comes to talking about technology, the impact of technology on public health and public health education is very clear. Our education needs to take into account of what technological advances can bring and the opportunity that comes with it. The next is around geopolitical shifts. We have seen this tension between China and the United States bringing to bear global issues in terms of how we are able to manage an outbreak, a pandemic that affects the rest of the world. Issues around displaced populations, equally, what is happening in Myanmar around some of the displaced populations that has subsequently resulted in a COVID-19 spread in their capital, in Naypyidaw, in some of the larger cities, including Yangon. Those issues are of public health relevance, but they are geopolitical in nature. So when we start to think about public health education, we cannot just simply think that it is a singular discipline. We learn about statistics, we learn about infection prevention and control, and not realize that geopolitical issues, be it even trade deals, I talk about the RCEP in the bottom right picture. When you have trade agreements between countries, what does that do to issues such as taxation on sugar, taxations on tobacco? Because those may contravene trade deals. And those are exactly the kind of impact that public health education needs to provide and needs to realize that it is beyond just a simple form of education, but including realizing what are the challenges that are brought about because of geopolitical tensions. Finally, I think climate change or generally future trends in terms of demography changes, population changes, be it changes in age spectrum, be it changes in where people are residing, the way that communities are moving from the rural to the urban parts, all this comes along with pressure, and those pressure translates to impact on health outcomes. Health is one of those issues that when social science matters are allowed to degrade to a level, that's where public health problems occur. And I think we can spend a lot of time talking about this, but let's save some time for conversation over the questions. We have also seen during the morning session and in the afternoon session, some of the strategies that have been put forward for educating, teaching at the university level, or even in primary, secondary, high schools during COVID-19. But I think broadly, these are some of the principles that have been used. Whether it is some form of reopening, staggering, there's some reliance on online education, where for people who are still going to school, there is now a greater emphasis on safe management measures, including mask wearing, temperature screening, disinfection protocols. Some activities, including physical education, has been limited. But I think what is important to highlight is this issue around inequity, because a lot of the strategies that we have heard about, be it in Singapore, Taiwan, Korea, are aided by the access to technology. They are aided by the access to Wi-Fi, online education. And that has a bearing on what is the extent that resource poor countries will be able to deploy the same solutions, because it's very clear that education is going to lead to greater disparity between the richer countries and the resource poor countries, because the richer countries have solutions that the poorer countries are unable to adopt. And this is where I want to talk about the issue around equality and equity. And I think there's a very simple cartoon here that really highlights that in public health, we don't just talk about equality, but rather we focus a lot on equity. And I will use this example of vaccines. Right now, again, this is an issue that is very pertinent, whether it is the COVID-19 vaccine or it could just be regular measles, mumps, rubella vaccination. You could have a policy that is equal, meaning everyone has equal access to the vaccine in a community. And that includes people in the rural region, includes people in the urban region. But that is equal access. What is equitable access? Equitable access is actually ensuring that people in the rural region did indeed receive the vaccine. It doesn't mean that there is equal opportunities, but you need to make sure that that opportunity is a real opportunity. It translates to actual impact on the ground such that the outcomes are very clear. Everyone, regardless of whether they're rich or poor, whether they're in urban or rural setting, they receive the vaccination. So that is why we always think about policies. They can be equal. You can put in place equal policies that highlight equality, that gives the same opportunity to everyone. But there will be implementation difficulties and differences in barriers such that the outcome may be different. So I think when we start to look at some of these issues around education, it's the same, because some of the equity issues has to go beyond just what we provide for citizens, for residents. When we think about global health education, I think one of the most important aspects is always that there is no textbook answer that works in Singapore. It will definitely work elsewhere. A solution that works in Cambodia may not be relevant in China. So there are historical aspects. Singapore, Taiwan, Korea, Hong Kong, we had a shared experience with outbreaks in the past, be it SARS, be it MERS. And in many instances, the preparation, the historical context have allowed some of these countries to shape their public health response, because the education aspect included what are the painful lessons we have learned from previous outbreaks. The social, the cultural context is again very important. In the morning, our colleague from Taiwan, they shared that in the Taiwan culture, they don't actually need rules to get people to wear their mask, because there is the trust, there is the community spirit. But I suspect if we go to a country in North America or in some countries in Europe, expecting that same level of community spiritness will not work. And that is why when we start to think about global health education, the social and the cultural context is very important to realize what is likely to work and what is likely not to work. There are issues around capacity and capability, economic issues, political issues. And I think for political issues, it's worth again highlighting that in many instances when we think about public health investment, for countries that have an unstable political outlook, meaning they change governments very rapidly, this is where public health tends to be neglected, because it is so much more visible to say that I'm pumping in funding to build a hospital, to ramp up all the resources to provide free treatment for cancer and so on. But public health investment, especially around health promotion, if I tell people that I'm putting in funding to support weight loss programs, the immediate impact to averting or avoiding future diseases is not seen in 4 years, 5 years. But 4 years, 5 years later, I may no longer be the government running the system. So if I'm the government today, I would be aiming for quick gains, and I want to show something that people will recognize me immediately. And public health often is compromised because of that. So that is why when it comes to public health education, our role in teaching public health, we have to remember the context of the matter is very important. And then this is where I want to highlight an opportunity. And the opportunity is really around learning from each other, learning about our painful experiences or our useful experiences, using cases, case studies. For example, thinking about some of these heated, not burned products or e-cigarette products in Japan. What are some of the useful lessons, both in advocating the policies? What are the challenges that happen? What were the aspects that make certain policies go ahead? Like in Thailand has a sugar sweetened beverage tax, but there were political opportunity that was available. There was also social movement that was available to be used successfully to push a public health program and a public health policy. And clearly, when we think about taxes, it's not just a health ministry problem. It involves the finance ministry. It involves trade ministry as well, because many of this you have to handle, like what I talk about, multilateral agreements with other countries. Public health education needs to understand all these different contexts. And the best way to learn is actually through some of these case studies. So this is where global classrooms, some of what our colleagues in Korea have announced and shared earlier on in the first talk becomes very important. The ability to come online, in person, like on this platform, to really learn about what other countries are doing, what are the challenges, what were the solutions that they found, how did they convince the stakeholders. The stakeholders could be the politicians, it could be the industry, it could be the public. What are the strategies that worked and what didn't work? Some realities when we start to think about capacity building, because especially when we think about education, right now there are a lot of global models that rely on overseas scholarships. I provide overseas development aid to some countries. I identify who are the brilliant people, whether they are policymakers, they are academics, they are future scholars. I bring them to a country, perhaps in the Western world or in our part of the world in Asia, for them to undergo a long period of education leading to a master's or a PhD. But there is always this issue that this approach allows a model of brain drain, because if I come from a resource poor country and I go to a resource rich country and I see all these opportunities, perhaps I may think differently about returning back home to contribute. And I think that in public health, that is one aspect that we have to manage very carefully, because the capabilities and capacity in many countries are limited. The other model is actually in running short courses where a team of lecturers, professors, they go over to a site, a country, a city, and then they run a program for a couple of weeks to transfer skill set. And I see this to be a very powerful way to very quickly ramp up knowledge and capacity to do things on the ground. But it comes with some disadvantage as well, because often this do not have formal accreditation or certification. So again, this is something that as the public health academic community, how can we collectively think of solutions to address some of the challenges that we see? So we really need to go beyond the traditional form of public health education and accreditation. Those who were around in the morning would have seen this slide where I talk about the fundamentals of public health. But I think we have seen Korea talk about multidisciplinary. We earlier heard our colleague from Taiwan also share that their public health specialist training, it's multidisciplinary in nature, talks about systems level thinking. These are our fundamentals. We have to stay true to them, but we have to find ways that we can impart this successfully. So again, I will leave 3 points for discussion. The first is trying to educate a global audience in public health, we will always face implementation challenges. But more importantly, we need to start thinking about how do we reduce this inequity, this brain drain that can happen with the current models. Our focus on implementation, monitoring, evaluating sustainable policies really means that we need the students, our audience in public health education, not just to be people who are thinking about health. You could be teaching public health to someone who is in the transportation ministry, who's thinking about international trade, who's thinking about foreign affairs, who's thinking about national development, thinking about water resources and environment. We need our own lecturers first to understand that our audience is not just to a health circle, but it's a broad-based group of audience that we are looking at. Many governmental ministries, including in the finance ministry, having a grounding in public health actually will help them tremendously in understanding this cross-sector partnership that is needed. And then the last bit, I want to highlight is that as an academic community, we really need to think very hard in terms of our collaborations with governments through the use of cases. When Singapore is thinking about sugar taxes, we learn from some of our neighboring countries, including Thailand, around what were the lessons that they have encountered when they implemented that sugar tax. So these are some of the very important lessons for public health education. And with that, I will stop here and over back to you, Chair.